Good day, ma'am. So for today's video, I'm going to do our turn demonstration that is all about bandaging. So bandaging is the application of a continuous strip of woven material used to wrap around the body part. So bandages are strips of clothes used to wrap around the body part, then used to secure dressing, apply pressure, and support wounds. So there are special useful injuries of the extremities. So there are some types of bandages. The first one is the ease bandage or elasticized bandage. So a commercially prepared bandage of a woven elastic material that is capable of giving strong support, then used for sprain, strain, and contusion. Then the second is the gauge. So a soft, porous woven cotton of a light weight that molds easily to body parts and used frequently to retain dressing.
So for the third type of bandage is the self-adhering conforming bandage. So it is a woven porous gauze that stitches and molds the body contours and is self-adhesive, such as the curlix or screen. Then the binders is designed for specific body parts that include limbs, abdominal binders, hip binders, and tree binders. The binders are used tools such as the flannel and machine or of elasticized materials that are fastened together with a velcro.
So the first method in applying the bandage is the circular turn. So it is primarily used to anchor bandages and to terminate them. So first step is hold the bandage in our dominant hand, keeping the roll uppermost, and unroll the bandage about 3 inches. Then apply the end of the bandage to the part of the body to be bandaged. Then hold the end down with the thumb of the other hand. Then encircle the body part a few times or as often as needed, then making sure that each layer overlaps 1/2 to 2/3 of the previous layer. The bandage should be firm but not too tight as the client. If the bandage feels comfortable, then secure the end of the bandage with tape or a safety pin over an injured area. So the next method is called spiral turn. So it is used to bandage parts of the body that are fairly uniform in circumference, such as upper arm or upper leg. So first is make 2 circular turns, then continue spiral turns at about 30-degree angle, each turn overlapping the preceding one by 2/3 the weight of the bandage. Then continue the bandage with 2 circular turns and secure the end with a safety pin. The next method is the spiral reverse turn. So it is used to bandage cylindrical parts of the body that are not uniform in circumferences, such as the lower leg or forearm. So first is anchor the bandage with 2 circular turns and bring the bandage about 30-degree angle. Then place the thumb of your free hand on the upper edge of the bandage. Then unroll the bandage about 15 cm and then turn your hand so that the bandage folds over itself. Then continue the bandage around the limb, overlapping each previous turns by 2/3 the weight of the bandage. Then make each bandage turn at the same position on the limb so that the turns of the bandage will be aligned. Then terminate the bandage with 2 circular turns and secure the end of the bandage with a safety pin. The next method is the figure of 8 turns. So it is used to bandage an elbow, knee, or ankle because they permit some movement after application. So the first step is the anchor the bandage with 2 circular turns, then carry the bandage above the joint around it and then below it, making a figure of 8. Then continue above and below the joint, then overlapping the previous turn by 2/3 the weight of the bandage. Then the bandage above the joint with 2 circular turns, and then secure the end with a safety pin appropriately. So that is figure of 8 bandage. The next method is the spica. So the spica is a variation of the figure of 8. It consists of ascending and descending turns that overlap and cross one another to form an angle. So it is commonly used to bandage the hip, groin, shoulder, breast, or thumb. A1 in bandage is frequently used for thumb spica, and A 3 inches bandage for a hip or shoulder spica. Next is the recurrent turns called a stump bandage. So are used to cover distal parts of the body such as the end of the finger, the skull, or the stump of an amputation. So anchor the bandage with 2 circular turns, then fold the bandage back on itself and bring it centrally over the distal end to be bandaged. Then holding it with the other hand, bring the bandage back over the end to the right to the center bandage, but overlapping it by 2/3 the width of the bandage. Then bring the bandage back on the left side, also overlapping the first turn by 2/3 the width of the bandage. Then continue these patterns of alternating right and left until the area is covered. Then overlap the preceding turn by 2/3 the bandage width each time. Then terminate the bandage with 2 circular turns, secure the end appropriately. Evaluate the peripheral circulation of the bandage.
Evaluate frequently the skin and bony prominences for signs of impaired circulation.